Hello friends, how are you guys? Well, we started. Your first, second and third months are over in 3 videos. Now we are in the 4th month. Are you enjoying it or not? We are going like a story. And you must be feeling that the baby inside you has grown so much. Some people might be able to relate to it. Maybe their dates are the same as I have told you, that is, March 1st to May 1st, May 1st to June 1st, June 1st to July 1st. Okay, so now your 4th month is almost over, that is, technically you are in the 2nd trimester. If you know that we have divided the 9 months of the entire pregnancy into 3 parts. The first 3 months are the 1st trimester, that is, the 1st trimester. The middle 3 months are the 4th, 5th and 6th. This is the 2nd trimester, that is, the 2nd trimester. And in the last, when your baby suddenly gains weight, it grows a lot, the belly starts looking bigger, that is the 7th, 8th, 9th month, i.e., 3rd trimester, i.e., 3rd trimester, so, now you have crossed the 12th week. Last time I had told you that we count in weeks, because we consider pregnancy to be at 40 weeks, technically, we doctors consider 1 month to be 4 weeks. Although every month has more than 4 weeks, there are 4 weeks, i.e., 28 days, but some months are up 30 days, some are of 31 days, this causes some disparagement, according to the sonography in the date we calculate for you. It is correct, so, what changes will happen after the 4th month? First of all, a little belly will start appearing. Very thin ladies will not see it even now because the uterus is your womb. It has just come out of the bone, which means that the uterus remains inside your pelvic bone. By the 12th week, as soon as the 12th week ends, it comes inside the stomach. It becomes so big that it has come out of the bone and is inside the stomach. So, the first good thing is that the pressure on your urine and the pressure on the rectum. I told you in the previous video that the HCG hormone is secreted in large quantities till about the 8th or 9th week. And in the 10th week the placenta starts expelling it, but after that it gradually decreases, and by the 16th week it decreases completely. So your vomiting decreases, your urine pressure decreases, the pressure on your rectum, that is, the problem of stool, reduces a little. But you may have constipation because the progesterone hormone is increasing inside you. As the pregnancy progresses, the progesterone hormone will increase, and what does progesterone do to your breath? It increases the breathing capacity, so you breathe quickly, take small breaths like a normal person would take such breaths. A pregnant lady takes such breaths, and that is because of progesterone. Many ladies pant while talking or pant while walking a little, so if your blood pressure is normal, your weight is normal, there is no swelling in the legs, there is no breathing problem. That is, there is no problem in the lungs, there is no heart problem. Then if you are short of breath, it is normal. Every lady has different types, and that is only because of the hormone progesterone. So one problem which starts in the 4th month is that you start having constipation because the muscles in your intestines do not work so much, so the movement of the intestines is reduced by progesterone. Okay, now what changes come in the child? As I told you, in the 12th week the child gets sexually developed, that is, a boy looks like a boy and a girl looks like a girl because his external genitals are fully formed. These things become more prominent in the 16th week, so if a doctor is examining him, of course, he is not allowed to tell us and you are not allowed to ask. It is absolutely illegal, but if we are looking at the machine then all those things are visible with more clarity. The eyes which we could see in the 12th week, now the eyelashes also start to appear. Hands and feet grow a little more and the total length of the baby reaches approximately 2.2 inches to 4 inches. Depending upon whether it is measured at 16 weeks or 13 weeks or 14 weeks. Because within 4 months, the 4th month is there and there are 4 weeks in a month. So, if we give a range, then the baby grows from 2.2 inches to 4 inches. Okay. Hands and feet are very clear. Now to measure the length of the baby, we have to measure the length from his head to his soles. So, now if we measure the baby, we do not measure his length because the baby's feet are fully open. Till the 12th or 13th week, his feet do not fully open. They have very small feet and limbs. So, we can measure them easily. Now, if you measure the length of the baby, then the doctor will tell you that the length of the baby is 2.2 inches to 4 inches. It is very difficult for the doctor to measure the size of the head. We measure the stomach and the thick bone of the leg, which is the thigh bone, which we call femur. We then measure it and tell you whether your gestational age and the size of the baby is according to your age and your date. In the 4th month, as I told you, because the uterus has come out of the bone and entered the stomach, now you will see a little bigger stomach, especially when the 4th month ends, and that too in thin ladies. It is more visible when they lie down, after standing. They are so thin that it is not visible. In the case of slightly fatty ladies, their fat may also develop along with it, but the size of the uterus is not so swollen. It has just come out of the bone. So, when you lie down, the doctor will look at your stomach. They will feel by placing their hands that yes. Now they can feel the uterus. Now after the 3rd month, all the sonography is done from the abdomen. There is no sonography from the body. The vaginal sonography, which we call TVS, transvaginal sonography, is done till the 8th-9th week. After that it can be done from the abdomen. From the 4th month onwards we advise you to do exercise because now the time has come. First of all, that dangerous time is over. The 3rd month is over. We have entered the 4th month, when the child's uterus has come inside the abdomen. Then light breathing exercises, mild yoga, squatting positions. All these things we advise you. You can do brisk walking. Normal walking. In foreign countries people also do swimming comfortably till 9 months, so all these things are allowed to you. The only thing that is not allowed is jumping or wearing high heels or working. Ladies sitting with their legs hanging for a long time will cause swelling in their feet, because now the uterus has grown. Now the blood vessels, muscles, blood vessels inside you are getting pressed, so due to this pressure, when you sit for a long time, your feet will swell. Especially those who are obese have more pressure inside them.